Alright, this is brief overview of antipsychotics part 2. Next we have Quetiapine or Seroquel. It's in the group called 676 tricyclics or the penes. In this group we have Clozapine, Olanzapine, and Quetiapine, as well as Acenapine. But these three cause the most weight gain, they're heavily sedating and highly anticholinergic. We see that Quetiapine has the highest affinity for the histamine receptor. Something interesting is that it has an active metabolite called norquetiapine. Norquetiapine has its own activity. Something to point out is its activity on NET. This is the norepinephrine transporter. It's a norepinephrine reuptake inhibitor. We think its weight gain activity comes with its antihistamine activity as well as its activity on 2C, serotonin 2C antagonism or blockade. Quetiapine has a lot of metabolic side effects. It's important to monitor weight, blood sugar, triglycerides, and cholesterol with this. Quetiapine is touted to have a different binding profile depending on the dose. Important to point out that even a low dose of Seroquel has an increased risk of cardiovascular events. If you're using it as a sedative for insomnia, it's basically a high-risk, expensive antihistamine. Next, let's look at Risperidone or Risperidone. Risperidone is a benzoisoxazole derivative. What's interesting with Risperidone is that it metabolizes into 9-hydroxyrisperidone, which is also Paliperidone, or Invega. You see that CYP2D6 does this, it hydroxylates this carbon right there. We can call these the dones. We can also call the benzoisothiazole derivatives the dones as well. This is ziprasidone, lurasidone. Important to point out that none of these really cause weight gain. These dones do cause weight gain. The dones are going to block alpha-1, so we can see some dizziness. They have minimal to no anti-muscarinic effects, and they have less weight gain than we see with the penes, but we still see some weight gain with them. Again, this is the active metabolite of risperidone. This is paliperidone. It comes as its own drug. I was going to make a TikTok of drugs that are metabolized into other drugs that are already on the market. Another cool example is actually primidone. Primidone is metabolized into phenobarbital. Something important to know about risperidone and paliperidone is that they can cause hyperprolactinemia. This is elevated levels of prolactin, which can cause gynecomastia or breast enlargement and tenderness, galactorrhea, which is actually milk production, and abnormal bleeding and menstrual irregularities. Next, we're going to glance at Zyprexa or Olanzapine. Holy cow, this will make you gain weight. If you want to gain weight, get on Zyprexa. This is its side effect profile. It's very sedating. It increases triglycerides and cholesterol levels. We see orthostatic hypotension up here, and dizziness. We have xerostomia, which is dry mouth. We see it has the highest binding affinity for histamine receptors, as well as 2A. What's important to note about Olanzapine is it's also metabolized by CYP1A2. So again, as I mentioned in my last video, it interacts with smoking. So again, cigarette smoking is going to decrease levels and concentrations via CYP1A2 induction. With this one, you also want to avoid concomitant usage of benzodiazepines. Something I'll also mention is that we also use Zyprexa for chemo-induced nausea and vomiting with highly emetic medications. Also mentioned this is usually paired with a neurokinin receptor 1 antagonist like a Reprotent, a serotonin 3A antagonist like Zofran, and also dexamethasone, a steroid.